Is your cat having diarrhea? This is a problem that veterinarians see on a regular basis. Diarrhea is a word that we use to describe increased frequency and wateriness of stool. Other clinical signs that can go along with diarrhea are flatulence or passing gas, increased volume of stool, blood or mucus in the stool, and straining to defecate. This condition is a result of a failure of the gastrointestinal tract to do its job properly. It normally involves some sort of inflammation or injury to the small or large intestine. Fortunately, some cases of acute diarrhea in cats are not serious medical problems and can be managed in the comfort of your own home. Some of the things that can cause this type of diarrhea are eating garbage or unfamiliar foods, a diet change, minor viral, bacterial, or parasitic infections, and even anxiety or stress. In these situations, a fecal analysis testing for parasites should always be considered. Treatment will likely require a bland diet and some medication to improve your cat's diarrhea, prescribed by your VetPronto veterinarian. If there is evidence of parasites on fecal analysis, then further medication may be needed. Also, an additional fecal analysis will need to be run a few weeks after medication is finished to ensure that the parasites have been eliminated. In other situations, bouts of diarrhea may be the first signs of a more problematic condition, or even an emergency requiring immediate medical or surgical intervention. Ingestion of toxic or poisonous substances can be life-threatening and will likely require hospitalization and medical treatment and decontamination over a period of days. A gastric or intestinal obstruction caused by foreign material will likely require surgical intervention. In cats, strings are the most common foreign body. That's why if a cat is playing with a string, you should either take it away or at least don't leave them unattended. Serious viral infections, especially in kittens, such as panleukopenia, will require hospitalization and can have a very poor prognosis. Serious bacterial infections like salmonella from eating things like raw food may also require days' worth of hospitalization. Certain types of chronic liver and kidney disease can also cause diarrhea and may stabilize once the disease is managed. Pancreatitis is another condition that can also cause diarrhea, and you'll likely see vomiting at the same time. This may require hospitalization, or sometimes it can be treated at home. Cancer of the gastrointestinal tract is a cause of diarrhea that we see in older cats. Lymphoma is the most common type of cancer of the gastrointestinal tract. If the lymphoma is low grade and proper treatment is instituted, a cat can live a good quality of life for several years. As you can see, there are many causes of diarrhea. Most of these will require some sort of test to be run to diagnose it. Many of these tests can be run off of a simple stool sample. Sometimes your cat may need x-rays, an abdominal ultrasound, or even a biopsy via endoscopy or surgery. If your cat has had one episode of diarrhea or it clears up within the day, you likely don't need to contact a veterinarian. However, if the diarrhea continues or if it's accompanied by clinical signs such as lethargy, depression, a fever, blood or mucus in the stool, or even vomiting, then please contact a veterinarian as soon as possible. I hope this video has been both helpful and informative. Thank you for watching. Book your cat's VetPronto home visit simply by visiting our website at vetpronto.com or downloading our app from the Apple App Store or from Google Play.